My name is Kayla. I am 26 years old and I am from Mooresville, North Carolina. I have a skin condition called eczema. I noticed my first dry patch of eczema on my hands when I was 12 years old. As I got older, it started migrating to different parts of my body. Currently, it's on my hands. It's mostly dry skin and then cracks that bleed, and it's painful. I have it under my arms, and then I have it on my chest, basically everywhere on my upper region. So here's my basket of everything that I have in my possession at the moment. Prescription medications, like I have prescription. In terms of dermatologists, I've seen close to 10. We have rash cream, maximum strength for hands. I was prescribed a bunch of different steroids, a bunch of different non-steroidal options, up to the point where I did get my first dose of an injectable, but it only works to a certain point and it never clears up. It makes me feel bad about myself because why doesn't this work? Why doesn't any of this work?
I'm not a prize to be won.
Music is a huge core of who I am. I started singing when I was 2 years old, and I loved it. I have a full studio in my house now, and I do gigs. So I auditioned for American Idol, and I had moved on to the next stage in the audition process. And one of the producers pulled me to the side, and she's like, "Oh, you have eczema. Can you show it to me?" And I was like, "Yeah, sure." So put my hands up, and then she's like, "Oh." I was kind of embarrassed at that point, and then I didn't get called for the next stage. It definitely brought the high down very fast. Just drop.
Kayla, welcome. You look beautiful. Your skin looks... Oh, okay, now I see a little bit in your hands. Yeah, so you get so dry that you get little fissures. So I bet you when you close your hands, they crack open, right? Yes, okay. And they're itchy. I'm sure you scratch a lot.
Yes.
Anywhere else on your body?
Under my armpits.
Under your armpits? Okay. Okay, so you have a little bit of hyperpigmentation, which tells me it comes and goes over there.
Yes,
okay.
and then this side as well.
Okay.
And then under the breasts and
on the nipple area. Okay.
Yes.
Okay. How long have you had this?
It has been about 15 years now.
Okay.
Was prescribed steroids. It would go away, come and go, but then it just got to a point where it never really went away.
Okay. I mean, what I see here is eczema is the generic term for just a rash, and that's what it looks like. This severe form of eczema takes some treatments. So I really need to hone in on what treatments she's had so that we can really help to fix her. So you were prescribed prescription level steroids, right? Can you name any of them?
Mometasone.
Okay.
Triamcinolone.
Okay.
Pimecrolimus.
Okay.
Tacrolimus, which I believe is the sister.
Right.
Cortisone.
Okay. There are certain levels of strengths of medicines, and a lot of the ones that you mentioned to me, they're not super high in their strength. Have you done anything like halobetazole or clobetasol?
Clobetasol, yes.
Okay.
I used that and it stung really bad.
Oh, maybe it was a liquid then.
It was foam.
Okay. Wow, Kayla has done a lot. I mean, steroids and ointments and creams, oh my. But I think this has all been really confusing. I'm not sure if that steroid was strong enough for her. I'm not sure whether she's using an ointment versus a cream versus an injection. I really need to get all of this straight. So I think I'm gonna have to do something to Kayla that she's not gonna like. So I know you've been through this for a long time, and it's kind of frustrating, but I would like to kind of take us back to this first step and just try a good, strong topical steroid. See if we can make it budge at all with it. And I'm gonna give you an ointment, okay? Ointments are greasier, but they're actually stronger that way. They keep the moisture in your system, so to speak. Okay? Why don't you come inside and we will set you up with a prescription. I'm on the case now. We're gonna keep the past in the past because I feel like it's gotten out of control and become super complicated.
I've been treated by many doctors and prescribed a bunch of different steroids. So I'm very disappointed with that answer.
Okay, so I understand the frustration, but like sometimes we just have to go, okay, wait, have we really given this a good course? And so that's why I'm gonna, I'm dedicated. I feel like one of the things that maybe you didn't really try with me watching over breathing down your neck would be using a stronger steroid. So we're gonna try that for a good, like twice a day for a week to 2 weeks. We'll see how that goes. Do you feel like your instruments kind of trigger this in some ways?
Yes, I do feel that sometimes, like because you're essentially working the hands,
Right.
and especially on the knuckles, it doesn't give my hands any time to rest.
Okay. Well, was that gonna prevent you though from playing a little bit with me?
I still could. It'd be an honor.
Of course. I'm gonna grab my instrument then before you change your mind. Hold on.
Okay. I'm not gonna let past failures stop me from just trying it one more time. Why not? So I'm just gonna do it and just pray for the best.
So they're tuned a little bit different. I don't know if you want to have a choice if you prefer, because it's lower. See that top string? And it's probably out of tune.
Oh.
What are you gonna play for me here?
I wandered around and finally found the somebody who.
As I'm playing the ukulele with Dr. Lee, it is something that I never thought would ever happen in my life. Just like flying here, just like this whole entire experience was such a dream. I can't wait to look back on this and be like, holy crap, that was my life. I am dedicating It Had to Be You by Frank Sinatra.
It had to be you, wonderful you. It had to be you.
Wow.
Even though in the beginning it might have not seemed like it, in the end, and for this information and for this solution, flying was so worth it. Since I saw Dr. Lee almost a month ago, I've been using the steroids that Dr. Lee prescribed me, and my eczema cleared up. And that was the best result that I could have asked for. I feel like I have been given the gift of new skin. I can do whatever I want freely. My OCD has calmed down significantly because I don't have to worry about the risk of infection. I feel like I don't have to limit myself playing my instruments anymore and feeling like I have to stop during a performance.
Never fit your standards.
Being able to perform in front of people again, I'm just really over the moon happy about it.
I might not fit into your place.
I just still can't believe that this is me now. So thank you so much, Dr. Lee.